Old State House Museum Collections podcast. The Old State House is located in Little Rock, Arkansas, and it's been operating as a museum since 1949.
We have a really large collection, and unfortunately we're not able to have everything on exhibit all the time. We felt it was important to start choosing an artifact once a month and discussing it and introducing it to the public.
In an effort to make our collection accessible, really. Yes. That's really what this podcast is all about, making our collection as accessible as possible.
For this first podcast, the artifact we've chosen is the building itself, because the building is as much an artifact as it is a museum.
And how we've decided to look at the building is through the medical school's use of the Old State House between 1911 and 1935. And with the construction of the new state capitol, the present-day state capitol, all the government offices and all the elected officials moved all their stuff out, leaving the Old State House vacant.
And in 1911, after several groups jockeyed to have control of the Old State House, the medical school took over the building.
In 2001, the museum put on an exhibit about the medical school at the Old State House. The curator for that exhibit was Dr. Jonathan Wolf from UAMS, and in order to learn more about the medical school at the Old State House, we made the trip over to UAMS to talk to Dr. Wolf. The following audio is a result of that interview.
There were two medical colleges in Arkansas, both located in Little Rock. There was a private school, the Physicians and Surgeons Medical College. Then there was a second medical school, which was technically the medical department of the Arkansas Industrial University. Although it was part of the University of Arkansas and is the direct ancestor of the current College of Medicine here at the University of Arkansas for Medical Sciences, it received no funding from the state of Arkansas. So both the Physicians and Surgeons and the University Medical School taught the same curriculum, taught it in the same pattern. And it was, the two schools were roughly comparable, but neither one of them was in good financial condition. Abraham Flexner, who was not himself a physician, visited Arkansas under the auspices of the Carnegie Foundation in 1909, and he went to the campuses of both the then colleges in the city and reviewed how they were teaching, their curriculum, their support, and so forth. And he came to the conclusion that both of the medical schools in the city were totally inadequate, and both of them should be closed. They were a waste of resources. His report was actually published in 1910. And the result here in Arkansas was that the faculties of the two medical colleges determined that if they merged their programs into a single medical school, that they then considered that they could bring up enough educational resources and enough access to patients in local hospitals to meet the requirements for an accredited medical school. And this is indeed what they did. Morgan Smith, who was a physician who was on the faculty of the medical college and was associated with John D. Rockefeller, he had worked in the public health projects that the Rockefeller Foundation had in process at that time. Smith was concerned about the health of Arkansans if there were no medical school at all, so he promoted the merger. He was also concerned about further accreditation, and at that time all the medical teaching was conducted down on Sherman Street at the second site of the medical school after it left.